in my third year, my very first week on pediatrics, I was exposed not just so much to the pediatricians, but to a pediatric radiologist. And we had a patient come in, I won't name his name, but I remember his name to this day, and unfortunately is a 6-month-old boy who ended up having a liver tumor. And the pediatricians were like, these are relatively uncommon, phenomena, fortunately, and they were sort of confused as to how to work this up. And my mentor became my mentor. He was both a board-certified pediatrician and a board-certified radiologist, and did pediatric radiology and radiology with Theodore Katz at University of Virginia, world famous, and that was his mentor. And so I was in awe of this because he calmly explained to the clinical team what to do, what labs to check, how to work this up, what imaging to do, suggested the correct diagnosis. And it was a light bulb went off, and I was like, wow, I want to be like him when I grow up. I was going to do allergy, immunology, pulmonary medicine, and that went away very quickly after I realized I want to be a radiologist, because this is the person who seems to know everything. And he was in a unique situation in that he was not only a radiologist, but a clinician, so he bridged their world in a way that I just really had never seen before in my very preliminary exposure to clinical medicine during the first 2 years of medical school. So that was it. The light bulb went on and it didn't change. And I think this is pretty representative of the US and many residency programs around the world. They're expected to do a certain amount of presenting. They do these radiology pathology conferences, and they'll show a case from practice of X disease. And then they usually like to show 2 or 3 companion cases. And they, radiographics has been a big resource over the years for that. But I think this is in addition to the library, and residents and fellows will start to use cases from the case collection. Again, it'll be watermarks, they'll be clear this is an RSNA case, and they'll say, here's a case from the RSNA case collection of a companion to the entity that I'm showing. Or if they have to put together a lecture or review for medical students or for whoever else, they can use cases from the case collection.